Okay, we're going to get back started in the book with diseases of arterial circulation on page 117, and we're going to talk about hyperlipidemia. So, and on slide number 66, hyperlipidemia is the medical term for high cholesterol. Lipids, that's another word for cholesterol as well, but lipids include cholesterol, cholesterol esters, phospholipids, and triglycerides. So that's what lipids are. Cholesterol is a soft, waxy substance, and it forms cell membranes and various hormones. One of the hormones is called cortisol. It's transported through the systemic circulatory system by proteins called lipoproteins. Okay, so make sure you remember that. Transported by lipoproteins. We have two different types of cholesterol. We have low density lipoprotein and we have high density lipoprotein. You may have heard that called HDL or LDL. Now, the difference in those, HDL is good cholesterol. Okay, LDL is bad cholesterol. So the way I get students to remember that is H as in heavenly, meaning good, and L meaning Lucifer or bad. So that's how I always get students to remember the difference between those. So LDL is usually from a plaque buildup that can narrow the arteries. Now usually a lot of people may have a low HDL rather than a high HDL, and that means when it's low, when the HDL is low, it means that they need to increase their exercise, and it usually comes up. HDL carries about 1/4 to 1/3% of the cholesterol, basically. HDL carries cholesterol away from the arteries into the liver, where it's eliminated from the body. Triglycerides, these are usually like your starches and things of that nature, but they're the form that fat exists in the human body. Okay, an increase in triglycerides is linked to coronary artery disease, so you have to be very careful because triglycerides are a large component of your total cholesterol. So going on with that, let's look at arteriosclerosis on page 118. Okay. Arteriosclerosis and atherosclerosis, we're going to talk about those. Usually atherosclerosis starts first. Now, atherosclerosis is a buildup of plaque in the inside of the arteries, and this can lead to arteriosclerosis, which is because of that waxy buildup of plaque in the arteries, it makes the arteries very hard and brittle, and that's what's called arteriosclerosis. So that's the difference in those two. Let's see. Arteriosclerosis, when it gets hardened and brittle, it can lead to hypertension because blood flow obviously is not going to flow as well. The most common cause of arteriosclerosis is what I just said, atherosclerosis. Let's see, atherosclerosis results from a number of insults that damage the vasculature, like high cholesterol, smoking, high blood pressure, diabetes. All of these are risk factors for getting atherosclerosis. The lesions, well, what they do is they're associated with atherosclerosis. They're either a fatty streak, a fibrous atheromatosis plaque, and the complicated lesion. So to diagnose this, to diagnose atherosclerosis, we have to do an EKG to see if there's any heart patterns that are abnormal. The best thing to do, the most definitive diagnostic tool, is a coronary angiogram, where we can go into the arteries and take a look to see how much plaque and how much of an occlusion there is in the artery. Symptoms depend on the location and the severity and how well it's occluded. Obviously, the more occluded, the more chest pain you're going to have, the more shortness of breath that you'll have. So it all depends, but usually those are the two main symptoms, is chest pain and shortness of breath. Okay, we can try to cut down the severity of atherosclerosis by controlling our blood pressure, reducing cholesterol, reducing our fatty foods, lifestyle changes by increasing our exercise, and then of course medications are a big part as well. These are prescribed for the medications prescribed for atherosclerosis may be high blood pressure medicines to get your blood pressure down, cholesterol and triglyceride lowering medicines. But they may combine those two, hypertension and cholesterol medicines, to make sure that the atherosclerosis is being treated properly. Okay, let's go on to peripheral artery disease, and that's on page 120. Peripheral artery disease is a disease that affects the peripheral arteries in the body. So kind of like the same thing as the coronary arteries that feed the heart muscle, peripheral arteries feed the extremities of our body. What happens is they produce ischemia, which means a lack of blood and oxygen. Okay, so remember that word, ischemia, a lack of blood of oxygen. The patient may complain of pain, an impaired function, an infarction, which is the same thing as a heart attack, and tissue necrosis. And necrosis means a dying of tissue. Atherosclerosis is the main cause of peripheral arterial disease, obviously, because if the arteries become clogged and occluded, we're going to have trouble having blood flow to the extremities like it should. So the most common affected area is the femoral artery, which is, of course, is in the thigh of the leg, or it can be the popliteal arteries around the knee and mainly behind the knee is where it's going to happen. Usually this happens in men more than women, older men, 70 to 80 years in age, but it can happen in women too. The risk factors for this is, of course, if you have atherosclerosis, arteriosclerosis. It can be hereditary as well, and we can have environmental risk as well. So those are some of your risk factors. So the way that we diagnose this is we look at the limbs to see if there's any kind of ischemia, and if there, which again, ischemia means lack of blood and oxygen, and if the limbs are like a bluish purple tint and cold, that's a sign, or maybe even losing feeling or tingling sensation, that's a sign that the patient is not getting good blood flow to the area. So they're ischemic. They may have subcutaneous atrophy, meaning like a pitting edema, almost like when you press in, it doesn't pop back, the skin doesn't pop back up, it just stays dented in. They may have paleness or pallor, coolness, absent pulses, and that's usually how we decide. We'll check a pedal pulse, which is right on top of the foot, and that's how we decide if they have any kind of peripheral artery disease. A lot of times is the doctor will not be able to feel a pedal pulse. We can do a Doppler or a regular ultrasound, radionucleotide imaging, a contrast angiography is the most common thing to confirm a diagnosis, because again we can thread the angioscope in, or the catheter, into the femoral artery or the popliteal artery to see the blockage or the disease portion of it. Symptoms of chronic obstructive peripheral artery disease is what we call intermittent claudication or pain with walking. So we're going to have like a clubbing of extremities. Treatment is aimed at prevention of further complications, so we need to increase the blood flow, open up those arteries. So a lot of times we may have to do a bypass in most cases around the clot, or remove the clot altogether. You can take medicines to decrease the size of the clot or destroy the clot, but that can be dangerous too, and surgery can be dangerous. So we try to avoid this if we can. Alright, let's look at Raynaud's disease. the bottom of page 120. Raynaud's disease is not really an actual disease like arteriosclerosis. It's actually a condition that's caused from a disease, and it's like a numbness and tingling in the hands. But this is where small arteries or arterioles in the fingers and toes constrict, and it causes that tingling or numbness, or it may even cause spasms in the fingers and toes. You may have some discoloration, and you may even have some pretty bad pain with Raynaud's phenomenon. And we call it Raynaud's disease, Raynaud's phenomenon. They're all the same. Now, this is a very common symptom in the disease called lupus, so you may want to try to remember that. Spasms, they may come and go, and they're usually triggered when you get cold. When the patient is cold, that's when the spasms go, because the vessels will constrict, blood flow can't get through, and it causes the fingers and toes to turn white and start spasming. And then after it's over, the areas will turn like a pink or bluish color. Treatment for Raynaud's disease is protection from the cold if you do have Raynaud's condition. Smoking is a no-no because that will constrict blood vessels and cause the spasms to flare up. Relaxation techniques, okay, you don't want it to get stressed. And then, let's see, I believe that's it. If you look at figure 610, this shows you somebody that has Raynaud's disease. You can see her fingertips in the right hand are very white. They're probably cold to touch, and she's probably having numbness or tingling in them. So going on to aortic aneurysm, still on page 120. There's different forms of this. We have a fusiform or a saccular aneurysm, and you do not want to have an aneurysm period whatsoever. But a fusiform aneurysm has a uniform shape, it has a symmetrical dilation, and an aneurysm is just a dilation of an artery, okay? So the symmetrical dilation of a fusiform aneurysm involves the aortic wall, and the saccular aneurysm appears as a pouch that's outside of the artery. So here's the artery, and a saccular is like a little sac on the outside. Fusiform, nothing on the outside. Let's see. Aneurysm locations, we can have abdominal aneurysms, and we can have cerebral, or what we call brain aneurysms. So let's look into those. Abdominal aneurysms are usually in the aorta, and because the aorta goes down in front of the spine and it branches out into the legs. So that's why we call it an abdominal aortic aneurysm. And then the brain aneurysm can happen from, it can be familial, meaning in the family, hereditary, and if you catch them early, they can be removed, but you have to be very cautious. And unfortunately, a lot of people do not catch them early. Let's look at disorders of arterial pressure on page 121. We're going to talk about arterial hypertension in this section, pulmonary vascular disease, and pulmonary arterial hypertension. Okay, so a lot of these are the same, so you need to pay close attention. So let's start with arterial hypertension. This is also called prehypertension. So as I told you earlier, the basic blood pressure is 120/80. So prehypertension is going to be something slightly above those numbers. Essential hypertension is what we call this as well, or right after prehypertension. So we're going to look at the diagnosis, the risk factors, and the treatment. I want you to look on page 121 and look at table 6.1. As I told you, the normal blood pressure is 120/80. The prehypertension is 120/80 to 139/89. Then you have stage 1 hypertension, which is 140/90 to 159/99. And then you have stage 2 hypertension, which is 160/100 or more. So make sure you look over those and know those numbers for your different stages of prehypertension and hypertension. So when we take arterial blood pressure, we're measuring the force of contraction against the walls of the arteries, and then we're measuring the rest time. So again, we talked about this earlier, but remember the top number is the systolic number, and this is how how the walls of the arteries are contracting, the force. So 120 is a systolic, and then 80 is the diastolic. It's what we want. And the diastolic is when the heart is at rest. That's why you'll see a lot of people mainly focusing on the diastolic blood pressure, because the heart needs its rest time, just like our bodies need rest time. And if the heart is not resting, it's going to cause major problems, mainly with valves in the heart. Let's see. Risk factors for hypertension. We have, of course, age. As we get older, we're going to have blood pressure issues. If you're ever in pain, your blood pressure is going to go up. Stress will make your blood pressure go up. A sedentary lifestyle, meaning not exercising, sitting on the couch, eating potato chips, watching TV all day. Excessive weight will cause high blood pressure. Excessive salt intake is a huge risk factor for blood pressure. Alcohol consumption is also a risk factor for blood pressure. And then we also have our family history. So you could have the most healthy lifestyle, be an athlete, and you may still have high blood pressure anyway, just because it's familial. Let's see. Hypertension is the most common cardiovascular disorder. I'm sorry, my nose is itching like crazy. It affects about 20% of the population worldwide, and it's considered one of the major risk factors for heart disease, stroke, and kidney disease. And it's also called the silent killer because it usually presents with absolutely no symptoms at all. Primary hypertension, let's talk about that. This was what I said causes no symptoms. It's the silent killer. When symptoms do occur, and you may have some, they're usually related to long-term effects that has damaged organs, and you're getting those type of issues. The treatment of primary and secondary hypertension is to reduce the blood pressure. And so we're going to use antihypertensives, and we may also use a type of medicine called a diuretic, and this is what we call in lay terms a water pill, okay, to reduce the fluid in the body. Alright, so in order to reduce your risk factors, we said you need to lose weight. This is the most effective non-drug method to reduce blood pressure. Exercise 30 minutes a few times a week will decrease blood pressure. Alcohol automatically, just drinking a tad bit of it will raise your blood pressure without even having hypertension. Reducing fat intake and increasing your vegetable and fruit intake. It's been proven that vegetables and fruits are cancer fighting, high blood pressure fighting. So that is a major risk factor that you can reduce. Salt, okay, keep salt intake below 20. Water pill. The physician will prescribe you a diet and exercise program. And if you have prehypertension, the physician may just start with a diet and exercise, and then if it gets a little higher, he or she may add just a diuretic, and then it may get to the point where you need the hypertensive medication and the diuretic. But we try to do lifestyle changes first. Let's see. Okay, let's look at pulmonary arterial hypertension. And this is at the bottom of page 122. The average normal pressure in the pulmonary artery is about 14 millimeters of mercury at rest. So in PAH, pulmonary arterial hypertension, the pressure in the pulmonary artery are greater than 25 at rest and greater than 30 during the exercise. Okay, so that's the normals for those. Idiopathic and secondary causes of PAH. Now, remember, idiopathic means unknown causes, and secondary causes means it's usually caused because of some other type of treatment or disease. But they cause vasoconstriction in the heart. They cause smooth muscle proliferation, and then they cause fibrosis or thrombosis of the pulmonary capillaries, which is little tiny blood clots. Symptoms of PAH are dyspnea, which is shortness of breath or painful breathing. It can be syncope, loss of consciousness, or fainting. And then as PAH advances, the pumping ability of the heart is going to dramatically decrease, especially when the heart is at rest. It's not going to occur. It's not when the heart's at rest. That's when you're going to have the worst symptoms. And then when you're resting, you'll have some pretty bad symptoms. The prognosis of PAH is poor. It has a median survival of less than 3 years. Treatment, we can do medication, oxygen therapy, and we can have a lung transplant. So survival rate not too good for this condition. We're going to stop there for this section and pick up in the next video with venous thrombosis.